this year's UNC Water and Health Conference. My name is Sarah Lebu, and I'm a PhD student here at the University of North Carolina, Chapel Hill, and I also work at the Water Institute. I'll be a room host for today, and before we dive into the fun part, I have a couple of announcements. I would like to remind everyone that we have the networking and sponsors events running throughout the conference week. And today's networking event in particular is starting right after this posters session. And that will not be happening on Pathable, it will be on the Remo platform. Instructions to sign up for Remo can be found on the conference website. Please tune in. I would also like to highlight our Careers in WASH for Young Professionals event, and that's happening almost right after our posters presentations. So please connect and tune in if you want to meet with the other young professionals as well. Also, this is a reminder that the Late Early Show will be happening tomorrow, and Dr. Regina Suter and Alexandra Wingsha will be recapping today's sessions, and they will be applying those to the Southeast context and also to the Pacific region context. Also, this is a kind reminder that the chat function on Zoom has been disabled, and therefore, if you have any comments or questions for the speakers, please direct those to the chat feature on Pathable, and a screenshot of what this looks like has been shared on your screen. And for now, these are the different posters that we'll have presented in this event. And so without further ado, I'm gonna stop sharing my screen, and I will introduce our first poster presentation speaker. So we are going to have Arwa Bharmal come first. Arwa is a program lead at the Center for Water and Sanitation at CEPT University. Please go ahead with the presentation, Arwa.
Hello everyone, my name is Arwa Bharmal from the Center for Water and Sanitation at CEPT University, India. Today I'll be speaking on safety of why in the state of Maharashtra in India. The focus of our study was on how to institutionalize provision of PPEs for sanitation workers. Like we all know that sanitation workers provide essential public services which underpin the functioning of cities, often at the risk of their own health and safety. The current COVID-19 pandemic has shown that sanitation workers were at the front line and working relentlessly on the ground, which was a multi-dimensional systemic approach-based study to understand usage as well as access to PPEs. To start with, profiling of sanitation workers was done to understand the number of sanitation workers, the kind of activities they are involved in, when and how PPEs are provided to them, how they use it, and what are the essential barriers or limitations as to why they don't use it. So based on this, a detailed assessment of the functioning of local government was done. Like, for example, in Y, many of the services relating to sanitation have been outsourced to private labor contractors. So we did an assessment of all the contracts of the sanitation department. Then we also did an assessment of the national guidelines as to what do guidelines says on provision of PPEs. Then we conducted a detailed qualitative discussions with sanitation workers to understand the challenges, to understand why they use or don't use a particular gear, etc. Then we conducted interviews with the vendors. The private market situation was assessed as to is there demand, is there a supply of PPEs in the market, and activity-based PPEs are there or not? Are they easily accessible? So that was also done. Apart from that, existing monitoring and replacement regime that is followed in the local government was studied to understand replacements to understand the monitoring of the PPE gears. Now, the study overall found that the usage of PPE by the sanitation workers was low. The local government annually provided the PPEs. They were not work specific, and most of them were not even gender specific, and they were not replaced on a timely basis. So once the PPE was provided, the usage was also not monitored, and the replacements were not frequent. So what we did was that based on the national guidelines, we prepared a list of what to procure for whom. And that way, that was the first step of providing the PPE in the first round. Thereafter, we helped the local government design particular clauses relating to PPEs as to how many to provide, when to replace, making it mandatory for the private operators to provide as well as monitor and replace the PPEs. We then, on the sanitation workers front, we conducted a series of workshops, training workshops, health camps, counseling sessions to make them understand that why is it important to use PPE and what are the health impacts. So based on all this, we then observed that gradually the usage of PPEs improved. And one of the major reasons was also the monitoring mechanisms, because we help them prepare registers which are paper-based, as well as digital tools were also developed, very easy to use apps which the sanitary supervisors could use to assess whether they are using properly or not. So, another achievement was that from the private sector also, the private labor contractors, they provided the PPE. Since it was now in the contract, they also monitored whether their workers are wearing, and they also provided timely replacements. On the sanitation workers front, we found that gradually they opened up to talking to us what are the challenges, and then once they knew what were the impacts, they started using it. And with the COVID pandemic, it helped them use it more. So now one of the achievement is that now they demand themselves that my particular gear needs to be replaced. Now they demand for it earlier, which they weren't doing. So yeah, that is it from my end. And thank you all for listening. Thank you.
Thank you so much, Arwa, for your presentation. We really do appreciate it. I invite folks to kindly type in your questions and any comments that you have directed to this speaker on Pathable, and I'll be monitoring those on behalf of the speaker. And while folks are still articulating their questions, I'll start us off. So Arwa, can you describe some issues around social stigma that the sanitation workers faced, if at all?
Yeah, thank you, Sarah. The question is quite valid when it comes to sanitation workers as a job, which is what we have found that in most of the cities, it is something that passes on from generations. So that is something, and it is very, in India especially, it is caste specific. So hence there are barriers as to getting into a different domain. So they are limited to working in the sanitation space, being as sanitation workers. But within that, now there have been many initiatives by the local governments to give them formal training and formal on-the-job training, wherein they can even shift their domain now. So it's not necessary that they remain sanitation workers, but now they can also work as, for example, say a peon or an office assistant. So those kind of initiatives also have been taken gradually, but good part is that there's some progress on this front.
Thank you for that. We have one question in the chat. It says, what were the processes of controlling the contaminated medical waste if we consider the PPEs as medical waste after using for a certain period? So I'll repeat that. What were the processes of controlling the contaminated medical waste if we consider the PPEs as medical waste after using for a certain period?
To be a little clear, the assessment is based for sanitation workers who are dealing with, do not deal with medical waste per se. So that is a separate category of workers for which the study wasn't conducted. But from our experience of working with the local government, especially now with the COVID pandemic, specific guidelines have been in place when it comes to disposal of medical waste. So those guidelines are being followed now. That is what I can say. Yeah.
Thank you so much, Arwa. I think we have if you can, in just half a minute, just if you have any other final thoughts and maybe some key takeaway points that the participants should come with.
Yes, just one point that I would like to make based on our working at the local level with the government is that if we want to improve lives or dignity of sanitation workers, it is very important to institutionalize our interventions. And by institutionalization, I mean making it more sustainable. In order to make it sustainable, it is important to include, for example, for tenders, it is important to include clauses. It is important to include guidelines which make it mandatory for ensuring their safety. And at the same time, coupled with awareness and capacity building for sanitation workers, that again has to be made mandatory if we want to, in the longer run, it's not only then limited to the COVID pandemic currently, but then this impact will go on and stay. So that is the point that we have worked on for these cities. And yeah, thanks.
Well said, Arwa, and thank you so much for your presentation.
Yeah.
So next, we will switch gears and go to the second presenter. And allow me to welcome Hannah Lohman. Hannah is a PhD student at the University of Illinois. So Hannah, the stage is yours.
Hi, my name is Hannah Lohman, and I'm a PhD student at the University of Illinois in Urbana-Champaign. And today I will be talking about the impact of locality-specific factors on sanitation system sustainability using a Python package that we're developing, QSDsan. And today, the overarching goal of this work is to explore how the implementation context influences sanitation system design and sustainability. And I'll skip over to the methods and discuss the sanitation systems that we'll be looking at. And so we'll be looking at 3 systems based on a study conducted in Uganda, led by John Trimmer from our research group. And the first system is alternative A, and it uses a pour flush toilet or a pit latrine and vacuum collection truck to take the contents to a centralized treatment plant, where we'll be using sedimentation, anaerobic lagoons, and unplanted drying beds. And then we can recover nutrients in the form of solids and liquids. The second alternative is similar, except at the centralized treatment plant, we'll be using anaerobic baffled reactors and liquid treatment beds and solids drying beds, where we can recover biogas as an energy source and then recovered liquids and solids as a nutrient recovery process. And then the third alternative uses a urine diversion dry toilet, where we can separate urine and feces. And this allows us to recover more nutrients. And then we'll be using a hand cart to take the urine to a treatment plant and then truck transport to take the solids to the treatment plant, where we'll be using anaerobic lagoons and unplanted drying beds, both to recover nutrients in the forms of liquids and solids. And then the 2 methods we'll be using are techno-economic analysis, where we'll be calculating the annual net cost of each alternative. And then we'll also be using life cycle assessment to calculate the annual per capita greenhouse gas emissions for each system, We'll be focusing on the construction, transportation, direct and energy emissions, and then we can have offsets due to the recovery of resources. And so I mentioned that these 3 systems are based on a study in Uganda. So we'll be looking at the Uganda results, but then we'll also be looking at different locations to see how the costs and life cycle assessment impacts change when we look at different locations. And so the countries we'll be looking at are Ghana, Zambia, Malawi, India, and China. And so we'll have 14 different location-specific parameters in the life cycle assessment and the techno-economic analysis that will be changing based on the location of interest. And so these are all conceptual ranges showing where each country falls. And so you can look at a specific country like China and follow the downward orange arrow to look at where their values hit in the range of values. And so I did mention that we're using QSDsan, and it is an open source community-led platform for the quantitative sustainable design, QSD, of sanitation and resource recovery systems. And so I won't go into a lot of details about what QSDsan is, just that we are using this platform to model lots of sanitation technologies, and it is open source and community-led. So we would like anyone to contribute to our models on GitHub. And so if you scan the QR code up here, you can get to our GitHub group to look at all of the code. And then we also have the links below down here where you can access both our GitHub and the documentation for using QSDsan. And so quickly for the results. So this first box shows the comparison of the annual net cost per person per year. And you can see that C is much more expensive than A and B. But then when we look at the greenhouse gas emissions, C is the better performer in terms of the greenhouse gas emissions. And so there is a trade-off when comparing these systems. So you have to figure out what your system needs, how it needs to perform, what is your cutoff criteria, are you looking at a certain budget? And then we can also look at the different countries. And so in most cases, system B, which is this lighter blue color, is the best alternative. But you can see that in Zambia, system A becomes the cheapest alternative. And so you want to look at the specific country that you're in, and one alternative may be better for a certain country in terms of cost, but it might be a different alternative, might be the better alternative when you're looking at a different country. And so I will wrap up, and I'll just say that we have been doing a lot of work for our models and developing an open source platform to look at both the costs and life cycle assessment of different systems. And we would encourage you to go to our GitHub and look at the work we've been doing. Thanks.
Thank you so much, Anna, for your presentation. Again, I invite folks to type in their questions and comments on Pathable. And Anna, while folks are doing that, do you have any final thoughts?
Yes, sorry, I was making it full screen. Yeah, so I know I didn't get to talk about the actual Python package that we're developing much, but the goal is for us to develop an open source free package that people can use to look at any sanitation system that they're interested in evaluating. And so we do have a lot of different unit processes up on our GitHub, which is the website that hosts the Python package. And so we have a lot of processes such as pit latrines. You can model a pit latrine, you can model a urine diverting dry toilet, lots of different sanitation treatment technologies. And so we're always trying to add more and build more. So if you're interested in developing your own models, we would definitely encourage you to go to our GitHub and check out our code. And we're also developing YouTube tutorials that will teach you how to use the package. So if you don't have a lot of experience with Python, it's a free coding software, and so, or free coding language. So we'll also walk through how to use the package if you don't have any familiarity with Python.
Thank you so much for that. I know that you've included some links on your poster. It might be helpful to have those directly typed out on the chat so folks can have them easily.
Yep, I'll be sure to add that.
Any questions from the participants? In the meantime, Anna, I'm wondering, so if you met with a policymaker from one of the countries in your area of study, how would you communicate the importance of your research?
For the importance of the research for a specific context, is that what you're asking?
Mostly, how would you sell the work that you're doing to a government official?
Yeah, so specifically, if you're looking at one country, we imagine these tools to be really helpful when you're in the starting phase of trying to choose what technology makes sense for the community that you're looking at. And so if you are interested in comparing alternatives, you can use our tool to look at the costs of all the systems. Life cycle assessment might not be super important for the community members, but if we're interested in climate change, then you can layer on life cycle assessment. I didn't mention this yet, but we are also developing a package to use multi-criteria decision analysis. And so for that, we'll also be layering on community preferences and social performance of each system. And so you're able to take all of these topics that you might care about for decision making, and then layer all of that into evaluating what system makes sense. So the fact that it's a free software is super helpful because there are a lot of sanitation softwares out there that engineering consultants use, but our package is free. You have access to the code. You can model any system that you want. And yeah, it has a lot of flexibility that I think is useful because not every context is the same. So you can add on what parameters you care about. You can put in decision-making criteria that makes sense for your specific context.
Thank you so much. That's insightful. So let's keep this conversation going in the chat, even beyond the scope of this session. All the speakers are going to be able to answer your questions and comments and engage with you even after the session ends. And I will transition to our third speaker at this point. So I would like to introduce Uttam Saha. Uttam is the strategic lead at Practical Action. Uttam, the stage is yours.
Yeah. Hi, this is Uttam. I work with Bangladesh Office of Practical Action. I'll share the learning from our work in Faridpur, particularly the FSM work, fecal sludge management work, that improved the lives of the sanitation workers. Cities Fit for the Poor People is one of the important program in Bangladesh Office of Practical Action, aims to improve sanitation workers' lives in 10 towns, as well as at the national level by supporting sanitation network alliances and policy processes. Why we work with the sanitation worker? Because we found that they are an important stakeholders for the fecal sludge management market. Desilaging is an important livelihood option for this excluded group, and the customers, they also prefer this group because of multiple factors. But very interestingly, the last mile people, slum dwellers and low-income communities, they have only solution to get the services from this group. With the group, they do the manual emptying without any safeguard, and this results in a loss of dignity. They have lack of access to treatment facility for disposal of the collected sludge. This was the case of Faridpur also 5 years back. But during last 5 years, we worked with the Faridpur city and helped them to develop a inclusive model for delivering citywide services. We supported Faridpur city to organize the informal workers, and the city provided a lot of training, orientation, motivations, and helped them to get registered into the business cooperatives. And they provided the technical skill training, entrepreneurial skill training, and they signed a lease agreement with the cooperative of these workers. And they provided the desludging truck, pumps, machines to provide the services. In the city, these groups are now providing the services to the city dwellers, including the slum dwellers and low-income communities. What we have found after the inauguration of this model, within the 2 years of time, the income of the individual members that significantly increased. And also on top of that, they saved a good amount of money in the name of their cooperatives, which now the cooperatives are now revolving this fund among their members. And also they bought a land for their housing scheme. Apart from the income and using the technology, what we have found that they have increased their relationship with the city, with the district administration, civil society, and the community organizations. So these groups in Faridpur are not no more an emptier, rather than they are an entrepreneur, because they have a long-term plan for business, and not only the dislodging business, but also other businesses as well. They have mechanical equipment for providing these services. They have an agreement with the city. They have also some money within their organization, and they have now better access to services by other departments. We shared the learning with the national government and national departments who are developing strategy and national programs. And the national government, they recently developed Fecal Sludge Management Institutional and Regulatory Framework and National Action Plan, and they strongly recommend it for integration of informal workers into the public service provision. But for the real integration, we need a transformative model and a program, not a project, which will cover their organizational issue, their knowledge, skill, capacity issue, access to technology issue, access to finance, business development services, partnership with city and other private companies, so that how they can mobilize more resources and they can start, improve, and grow their dislodging businesses. Social security is another aspect. They do a hazardous jobs, but they need a social security scheme, occupational health and safety support. And at last but not least, they also need to build alliances with other peer networks so that they have a strong voice to the policymakers to realize the potential of this group and implementing the important strategy on the ground. That's all about.
Thank you, Uttam, for your presentation. I will invite folks again to ask any questions directed to Uttam and his research in the chat. Also note that again, the chat function on Zoom has been disabled, and we are encouraging you to type in your questions on Pathable. Uttam, while folks are articulating their questions, do you have any other thoughts to add?
Can you hear me?
Yes, I can.
Yeah, I think, the important thing that informal sanitation workers are really marginalized community, but they have inherential skill. So when we are talking about the new development program around the sanitation, actually time has come that how development program really can take up and they can be integrated with the program, with the project and program, and also the improved system. And the main thing, and also the specialized technical skill and also the can-do skill and passion should be required from the facilitating agency, because this is not a easy job. So this is not a job. If you have some passion for this particular group, then actually it is possible. And also it entirely depends on the attitude from the municipal council members, that how they will be supporting this group, whether this is from as a project purposes or from their heart. So from the very beginning, actually, these things need to be clear. And what I've said, that the really a transformative model actually is required that will address multiple issues for empowering this group and to keep them remain in the businesses. Yeah, that's all from my side. Yeah, over to Sarah. Yeah.
Thank you so much, Uttam. We are still expecting questions in the chat. But in the meantime, I will ask, so Uttam, in the absence of time and money constraints, what sort of solution would you recommend for this challenge? And I know you've mentioned a couple of things like providing PPEs, but if you had absolutely no constraint with time and money, what would you recommend to improve the lives of sanitation workers?
Yeah, I mean, it's what I have said that it's not only the PPE, but also it's about that creating a vision among themselves and providing the soft skills to them, particularly if you can show them a good path, and if you can create a vision among them that how they can come from these types of job or work, how they can set up their own business, how they can use that technology, how they can improve their lives, how they can improve their life. They can improve their dignity, acceptability to the community, and other things. So it's not only the PPE or external support. It's about that, more about that, creating a vision, providing the soft skill, and motivating the municipal council, because there are really an important group on behalf of the municipal council, because they are important stakeholders. So how municipal council, they have their regular revenue budget. So how really they can allocate some of the money for particularly supporting this group, as well as also they have the different unit. They have the conservancy unit and also the slum development unit, so sanitation department. So how they can develop their capacity to support this group in terms of providing the training, building relationship, making connection with the other stakeholders. So it's and of course the PP and other things, and also the what I have said, also the long insurance scheme and other things. So it's not only my sense, it's not only the PP or not only a project approach, how it's about creating a vision and motivating municipal council for extending their cooperation and adopting a proper long-term transformative approach. Yeah.
Really well articulated. Thank you so much, Uttam. Since we do not have any questions in the chat, I'll still keep encouraging folks to type those in even after the speakers have finished the presentation slot. And I will transition to our fourth and last speaker, but certainly not the least. So I would like to introduce Mariam Zaqout. Mariam is a PhD candidate at the University of Leeds. Mariam, your presentation, please.
Hello everyone. Today I'm going to talk about sanitation jobs. As we know, pit-emptying is still existing job in several countries, especially in low and middle income, and specifically in urban settings where there's a dense population that requires regular emptying for their on-site sanitation. The job in Bangladesh is specifically still existing because the mechanized services is still not fit enough to serve that context. So today I'm going to explore or to shed the light on some experiences of pit-emptiers from various socioeconomic status and with several religious and ethnic backgrounds. The study was based on a qualitative research, including interviews and focus group discussions with government officials, with NGOs, as well as pit-emptiers. The data analysis used the sustainable livelihood approach themes as a deductive mode coding to see the similarities and differences between each mode of pit-emptying. So the final results were 6 case studies. The first 2 were private cooperatives in Faridpur, they have a public-private partnership with the municipality there, and with the support of Practical Action organization. Their status in general has improved because of this new partnership. However, there are still restrictions related to their long-term sustainability of their job, as well as their further improvement of their social status and access to different opportunities beyond pit-emptying. The second two is the government employees. So there's two types, which is standard as well as on for government workers, but unfortunately this isn't the case there, and especially for on-call. The last two is self-employed, so informal and illegal pit-emptiers are the most common case actually, and there are two of them in this study, Dhaka and Khulna. Those two are usually from the Harijan, who are either Dalit or who are also called Dalit, and they have Hindu or Christian backgrounds, and their situation is the worst out of the six of the other two modes of service. Here I'm writing the key findings, which is really the environment and the policies. There is the key difference between each mode of service. It affects their livelihood outcomes, their assets, their access to services, their capacity to develop. We have also mentioned the religious affiliation and how it is affecting the prospects and the improvement, the growth of any group. So Muslim emptiers are more involved, more capable of developing their service. And also to highlight a very important finding is the social capital, and how important is this in this profession, and how we can in the future use it to improve their situation. Lastly, to iterate, emptiers in general have poor access to resources to ensure their well-being and long-term sustainability. To sum up, we need to explicitly address the needs of this sanitation service providers, and not only work on them as a side project next to our sanitation projects. Thanks for listening, and hope to hear from you in any interest related to this topic.
Mariam, thank you so much for your presentation. I invite you to share your screen and give any other additional thoughts that you may have. And in the meantime, please direct any questions that you may have for her presentation on Pathable. Welcome, Mariam.
Yes, thank you, Sarah. I'm not sure if you're seeing my screen now. I want to say hi to Mr. Uttam. He was a very supportive part of this study, actually. I did it mostly with Practical Action and with the SMV in Bangladesh. And I think the key message from this is that there are progresses happening in relation to sanitation workers' well-being, but still we need more organized work, and a work that ensures sustainability beyond the involvement of NGOs, because we know that the NGOs projects are has always end time. So we need something that the sanitation workers are comfortable with and are able to sustain on their own without the support, without external support. So yeah, that's basically it. Thanks a lot for listening, and yeah, happy to have any side discussion after this.
Yeah, thank you for that additional insight. I'm just as a follow-up, where is the direction that your research is going to take after here?
So this was part of my master's degree research. I'm now in a PhD, and I'm doing sort of research related to the incentives of funding sanitation services. So I'm trying to look at the sanitation workers still to understand what is their position in terms of private sector. So part of my study is looking at what is the incentive of the private sector to be involved with pit-emptiers, how they are planning to improve their conditions, and whether there's a specific interest to look at their situation, or it's only to to make sure that the private enterprise is working and in terms of sanitation delivery, and not because we want to help sanitation workers. So it's still there. I have a couple of master students that I'm supervising, and we are looking at different cases in Kenya mostly. And yeah, that was it.
Thank you so much. I'm just wondering, what are the best resources for people who want to dive in deeper in your work? Do you have any link to something?
Yes, I am happy to share my published paper, as well as some blog, as well as another blog that I've written earlier this year. So yeah, I will share in 1 minute.
Thank you. Those will be really helpful.
And yeah, the topic is getting lots of attention. So I think it's easy relatively to find resources from World Bank and Practical Action and so many other NGOs.
Thank you. I think we do have one question in the chat. So Lina Musoka is asking, could you share a little bit more about the religious background aspect of your study? And was the finding you shared about Muslim communities surprising to you?
Yes, it's a great question. So basically, the sanitation workers, as Mr. Uttam might correct me if I'm wrong, it has a lot of history with the colonial background of Bangladesh. So the British Empire asked some people from the Hindu origin from India, who immigrated from India, to come to Bangladesh and start this job. And then after those Hindus had some conflicts with the government at that time, the government decided to punish them by ignoring them and leaving them from this job. So they asked Muslim prisoners who were in a prison if they can start this job in return of leaving the prison. So this is how the Muslims became involved with this job. Over time, Muslims, because of their behavior in general, so for example, Hindus and Christians do consume alcohol while working because of the smell and because it's just not a very pleasant work to do. On the other hand, Muslims, they don't. So people perceive this as a more appropriate behavior. So they prefer Muslims because they are less aggressive. They don't drink. So it's for the customers, it's more respectful. And also we got this from Faridpur basically, and the two cooperatives that Practical Action worked with, that Muslims are relatively more organized than Harijans, because like Hindu Harijans, they are apparently more keen on developing their work. I'm not sure. I do believe this could be a bias from the municipality there, or it's just because I think the alcohol thing is a little bit something. And myself, I am a Muslim, and I was in Bangladesh, and people were very welcoming to me. And I understand that they could be a extra support for Muslims because it's the dominating religion in that country. But I won't say this is the main reason. And I do really wish to see more balance between Muslims and non-Muslims, because I mean, it's already bad, very, very tough job. But I think the story goes in a different way. Just one last remark. The story goes different way if we are talking about India. So you will find that the Harijans are more accepted and the Muslims are not, because it's a different religion in that country. So that's mainly it. But yeah.
Thank you so much for those insights. Unfortunately, we've come to a close, and I would just like to encourage folks to please connect, go and tune into the REMO platform for the networking and sponsors events that are going to take place right after these poster presentations. And thank you really so much for attending this session. I would also like to say a big thank you to all the different sponsors, particularly those that supported this event. So thank you all, and I will see you in the networking session in a bit. Thank you.
Thank you. Thank you, everyone.
Thanks. I have added the links.